While small fiber neuropathy following COVID infection was very specific, I was able to find something on it. Now, in some people, long COVID symptoms include unexplained fatigue and exertional intolerance, as well as dysautonomia and sensory concerns, where dysautonomia is the regulation of things like heart rate, blood pressure, and sweat. And there has been indirect evidence linking long COVID to incident polyneuropathy affecting the small fiber axons. This is a cross-sectional longitudinal study where data from patients was provided by the World Health Organization. Patients were selected that did not have prior history of neuropathy or any risks, and were subsequently referred for peripheral neuropathy evaluation. This study includes 17 patients, and of these 17 patients, more than 10 received small fiber neuropathy diagnosis. And small fiber neuropathy after mild COVID illness was the most common, beginning within 1 month of the COVID disease onset. Evidence is suggesting an infection-triggered immune dysregulation as a common mechanism. So 16 of those 17 patients had mild COVID, and again, that one patient had severe COVID with an ICU stay. And they had confirmed sensory motor polyneuropathy in addition to small fiber neuropathy. Of the mild cases, 10 were able to have their diagnosis confirmed with a lower leg skin biopsy, which makes the total here 11 patients that had the small fiber neuropathy. And all 11 of these patients had reduced or abnormal distal pinion vibration sensations with absent Achilles reflexes. So what is small fiber neuropathy? These are the small diameter unmyelinated or thinly myelinated sensory and autonomic fibers, which makes them susceptible to environmental stressors like your internal immunity. So the really nice thing is that if you remove these stressors on the immune system, then the small fiber axon should be able to repair themselves through reinnervation, and this is because they're continuously dividing tissues throughout your life, which means you are likely to heal over time.